Alright, last section. Had a little technology malfunction, but here we go. So these are already highlighted. You need to know all of these here on the skull. This is page 136. And then we're going to know all of the ones here about the vertebrae, and that's on page 137. Okay, so you can see all of them are labeled there. Just make note that you have C1 and C2, that there are different characteristics with those. Then we're going to kind of flip over here to this page 141. These are all the muscles that do facial expression. Okay, so we'll kind of look over these a little bit, but you're not going to have to memorize really anything on this page. That's the same thing with the next page over here that continues on. You don't need to remember any of these. We'll kind of just do some different things with them in class, but nothing to put on a note card. This is where we'll start. The platysma, you have the origin. This is the fascia. Insertion is the mandible. Subcutaneous tissue, skin. Does depression of the mandible, depression of the lower lip, tightens the skin of the neck, and it's the fascial nerve. Okay, it's the very superficial muscle of the neck. Now we're going to get into the muscles of mastication or chewing. So we have the temporal or temporalis. It's going to originate on the temporal bone. It's going to insert on the mandible. Action is elevation, retrusion, and unilaterally it will do lateral deviation to the same side. And this is your trigeminal nerve. That's your cranial nerve 5. Okay. And you can palpate this one very easily. Masseter originates on the zygomatic arch, inserts on the mandible, does elevation, assists with protrusion, and unilaterally, meaning there's two. You have a right and left, masseter, right and left temporalis. It's going to do lateral deviation of the same side. And then you have the trigeminal nerve, again, cranial nerve 5. Orbicularis oris is the maxilla, mandible, lips, buccinator muscle. It's origin, and then it's going to go to the lips. Okay. It's going to assist with closure and protrusion of the lips, and this is facial nerve, cranial nerve 7. Buccinator is originating from the maxilla, mandible, inserting on the lips, maintains cheek tension. That's, food position for chewing. When you have air, it's cranial nerve 7. Okay. Continuing on here, we have the medial pterygoid, P silent, and the lateral. So we start from originate from the pterygoid plate, inserting on the mandible, does elevation, cyst protrusion, lateral deviation to the opposite side. So that means if I'm going right, it's the left medial pterygoid. And this is the trigeminal nerve 5. These are difficult to palpate, but we'll kind of palpate them in class. You kind of have to stick your finger inside your mouth. But I'll walk you through that. On the same origin insertion on the lateral, we do add the TMJ joint capsule. This does protrusion, depression, and it's going to do lateral deviation to the opposite side. And it's the trigeminal nerve, cranial nerve 5. Okay, here, only thing you have to remember is that the suprahyoids are those four: mylohyoid, digastric, genohyoid, stylohyoid. Okay, and you need to know that these elevate the hyoid bone and help with depression of the mandible. Okay. Kind of same story on this next page. You have infras, meaning they're below the hyoid bone. You have thyroid, hyoid, sternohyoid, sternothyroid, sternohyoid, omohyoid. And this stabilizes it when swallowing. Okay, and helps with depression. Alright, Now we're going to get right into the neck muscles. Sternocleidomastoid mastoid, SCM. It's going to start on the sternum and the clavicle. It's going to insert on the mastoid process. Bilaterally, it will do extension and flexion. To extension of the head due to the insertions up here. It'll do flexion pulling this way. Unilaterally, it'll do lateral flexion to the same side of the head and neck, and it'll do rotation to the opposite side. And we have accessory nerve, and then you have spinal nerve for pain and proprioception. Okay. And you can palpate this one, it's the one that sticks out. Okay. Scalenes, these are deeper to it. We're not going to differentiate between anterior, middle, or posterior, so we're just going to do it as a whole. And they start on the transverse processes, insert on the ribs, so between the first and second rib. And our actions here are going to be flexion, lateral flexion of the neck. This is going to kind of be flexion of the neck. Doesn't really flex the head. Doesn't attach to the head. Elevation of the first rib, and then it will do lateral flexion of the neck and elevation of the second rib. It has your spinal nerves. Okay. Brachial plexus and the subclavian artery go between the anterior and the middle one, so that's where we get to some brachial plexus issues. Okay. Longus colli. We're going to group it into that name there, and then we're going to know that it does flexion, lateral flexion, rotation to the opposite side, and our nerve is our spinal nerve. Okay, got a little information box here, so you don't need to remember individual names. Now we have longus capitis and rectus capitis. They're going to do flexion of spinal nerves, flexion, spinal nerve, lateral flexion, spinal nerve. Okay. So you really just have to remember those names. Kind of group them together. Okay. That's going to help stabilize the atlanto-occipital joint right in there. Alright. Intercostal muscles. We have external intercostals and internal intercostals. Okay. So external intercostals, we have ribs. Internal intercostals, we go from kind of the sternum, posterior ribs. Okay, so they're really going to originate from the adjacent ribs, insert, so it's these right here. Okay, so one goes this way, one goes that way. Okay. Action, they're going to be elevation. Nerve are going to be your intercostals. It's going to be the thoracospinal nerves and the ventral. Okay. Really want you to remember that one. Talk about the rest of these in class. So I'll mix up your breathing muscles there. Okay, subcostal muscles, transverse. Not going to worry too much about those, but that you have just more little muscles They're going to help the ribs with breathing. Okay, the diaphragm. We're going to originate here from the lumbar, from the costal cartilage in the xiphoid process. We're going to insert onto the central tendon of the diaphragm. It's going to flatten that tendon. And this is the phrenic nerve for C3. So if you have a spinal cord injury above that, or at C3, you can't breathe on your own. Alright, here's just some more muscles that help with breathing. We'll talk about those a little bit more when we get to that chapter in your book. Quadratus lumborum. Iliac crest inserts on the rib and the transverse process. Stabilizes 12th rib unilaterally with lateral flexion, elevation of the pelvis when those are fixed. This is your spinal nerve. And this is kind of deep to palpate, but sometimes you can get to it. And this is what we call the hip hike, right here. Alright, we have our abdominal muscles. Okay, our rectus abdominis is going to start from the pubic symphysis, pubic crest, going to the ribs in a xiphoid process. Flexion of the trunk and supports the abdominal viscera or organs. It's your thoraco-abdominal nerve. Okay. Upper portion is the stronger portion. External oblique. Starting with the ribs, going to the linea alba, pubis, and the anterior iliac crest. The linea alba is a connective tissue. Bilaterally will flex trunk, have compression, unilaterally will do lateral flexion, and will rotate to the opposite side. So you have the thoraco-abdominal, and then you have the subcostal nerves. And you can palpate these. You can try finding this muscle that kind of tells you how to do that. Then we'll go on the inside to the internal obliques. Inguinal ligament, anterior iliac crest, thoracolumbar aponeurosis. Do ribs, abdominal aponeurosis, linea alba. Bilateral will do flexion and compression. Unilateral will do lateral flexion, rotation to the same side. Okay? That's the thoraco-abdominal nerve. That'll kind of tell you how to find those internal obliques. Transverse abdominis. This is a very deep one. And the ribs inserting on the abdominal aponeurosis, linea alba, and the pubis. Really there to support the abdomen. And it's the deepest. And it runs horizontal. Okay. Here we're going to get to the posterior side. And we're going to go to the splenius capitis and splenius cervicus. Okay? So we just need to remember capitis, cervicus, and that their actions all do these. And it's spinal nerve. We're going to do spinal nerve C1 through C6, dorsal rami. Okay, here we're going to group these into suboccipital muscles. We'll group them into the capitis muscles. and that they do extension and rotation to the same side. Then we have here, so obliquus capitis, do extension, do rotation, and all four of these muscles have the suboccipital C1. Okay. So these are the suboccipital muscles. When we talk about doing a suboccipital release, these are the muscles we're releasing. Alright, erector spinae, these are grouped. Okay. You need to know the names of these. Okay. And they have sections. Capitis means head. So this is cervical thoracic lumbar, head cervical thoracic. Head cervical thoracic. So make sure you keep those separated. Originating from the thoracolumbar fascia to the ilium, sacrum, sacral ligaments in the spinous process. I'm going to insert to the lower ribs in the transverse process for the iliocostalis, the longissimus, ribs, transverse process, and the mastoid process. Okay. Spinalis, spinous processes. And then we have the nuchal lines. Actions, all of these. And that's the spinal nerve, dorsal rami. It's a good box to read, kind of get that. These are very long muscles going from sacrum all the way to your head. Okay? They help extend your back. Transverse spinalis, these are all the little ones. You have the semispinalis, multifidus. Here's your nerve. Okay, these are very hard to palpate, they are very, very deep. Actions, do extension and rotation to the opposite side. This does stabilization. You'll see in some articles they'll stabilize for rotation. Okay, so they go all up the spine from C2 all the way down to the lumbar. Okay. You continue on with these on page 166. You have rotators, so they're going to do bilaterally assist in extension, and then they're going to assist with rotation to the opposite side. Kind of tells you that with the name. Interspinales, they're going to assist with the extension, spinal nerve. Intertransversary, lateral flexion, stabilization, spinal nerve. Okay. Just kind of a little continuation from the page before. Alright, now we're going to go into the pelvic floor. Okay. So all I need you to remember here is the name, the action, and the nerve. These names are very fun to say. These build up your pelvic floor, so make sure you make a note to this. We'll talk about this more extensively in class between the male and female pelvic floor. So here you can see the female pelvic floor. So again, some of them are the exact same as the other page. Females, we add in another one. Okay, so that is your trunk muscles.